Welcome to the recorded version of Seniors and Medication Management, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
All right, we have two presenters today for today's webinar. Lakelyn Hogan is a strategic partnership representative for Home Instead Senior Care. Lakelyn holds a graduate certificate in gerontology and is currently working toward a Master of Arts in Social Gerontology. She also holds a Master's in Business Administration and her undergraduate education focused on marketing and communication studies. Lakelyn has professional experience in the private and public sectors of senior care services. She has worked on special projects for the University of Nebraska Omaha's Department of Gerontology and the local area agency on aging. She is serving in her second year as the co-chair of the Nebraska State Chapter of the Alzheimer's Association Dementia Care Conference. Lakelyn has spent several years assisting senior clients and helping their families navigate the senior care continuum. She is passionate about helping others, especially aging adults and their families. Kyle Decker graduated from Butler University as a doctor of pharmacy. He is now a licensed pharmacist in multiple states and has spent the past 10 years leading large teams as the head of pharmacy operations. Kyle is Six Sigma certified and has developed multiple operational processes that have enhanced the customer experience and provided a safer way for customers to receive and administer their prescriptions. Throughout his career, Kyle has been at the forefront of driving medication adherence, medication synchronization, and ultimately helping patients manage their own medications. Kyle's primary areas of experience are clinical pharmacology, operations, strategy, and management. We're also going to have another presenter joining us, but at the questions and answers section later on today. Lanita Konoki is a registered nurse with a bachelor's in business management. Lanita is also a certified managed care nurse with a varied background in nursing, encompassing direct care and clinical business. Over the past 25 years, she has worked in home health and hospitals, all while diversifying her experience in the medical community. So Lanita is going to be joining us for the questions and answers for the last 15 minutes. But at this point, I would like to turn over the floor to Lakelyn Hogan and Kyle Decker, who are going to do the main part of our presentation. Welcome, Kyle and Lakelyn.
Thanks for having us. I hope everyone's day is off to a great start. And we're going to focus on a topic that is vital for the health of older adults, and that's medication management. And I know this has been a significant issue for many of the seniors that I have worked with, and I'm sure that you all have had very similar experiences. So I'm sure those experiences will be going through your mind as we talk through today's presentation. But I wanted to start out by talking about how medication management is the ultimate irony, because these remedies can save lives, but they also have the potential to sicken or even kill those seniors who may need the treatment. Oftentimes, medication management is a difficult subject to broach because it's so personal, and it's something that seniors have taken care of their entire lives, and to be able to give up that medication management or to ask for assistance can be really difficult. So we're going to dive deeper into this topic as we go through today's presentation, and I'm happy to have Kyle with me to give a pharmacist perspective, and you'll hear from him later on. So let's start with our learning objectives on the next slide. Throughout the next hour, we'll talk about the risks and challenges associated with medication management. And I'll also go over the signs of when medications are affecting health issues. Then we're going to take a closer look at common conditions that impact medication management and talk about how families can play a role in reducing the potential medication mismanagement risk. And finally, we'll end, as we always do, with some resources. But before we dive into the risks, let's take a look at some research on the next slide. This statistic might be surprising to you. I know it was for me, but over 100,000 seniors in North America end up in the hospital each year because of medication problems. And at Home Instead Senior Care, we've seen this problem firsthand in the homes of seniors, and because of this, we decided to do some of our own original research. So Home Instead, Inc. conducted a study where we interviewed a random sample of 500 seniors in the United States and Canada to identify their prescription habits regarding medication safety. And we found that as the number of prescription medications increased for a senior age 70 plus, it also increased the potential risk of medication mismanagement. It also posed some significant challenges. 1 of 5, or about 20% of the surveyed seniors, admitted that they had some difficulty managing their own medications. We also discovered that nearly 1 out of 5, or 17%, of those surveyed felt overwhelmed, at least occasionally, by the medications they were taking. And for seniors taking multiple medications, about 1/5 of those that were surveyed did not have a full list of the medications they are currently taking. And as you know, the seniors we work with, they go to multiple doctors almost on a monthly basis, so not having that list could be a significant risk or challenge when it comes to managing medication. And when it comes to unintentional medication mistakes, 1 out of 10 surveyed seniors had unintentionally made a mistake when taking a medication, and of those 1 out of 10, 11% experienced a medical issue or an emergency as a result. And then one final piece of data here on this slide, we found that 57% of those surveyed in North America take 4 or more prescriptions on a daily basis, and more than 1/4 of seniors took 6 or more medications. I don't know about you, but that's a lot of medications to keep track of. So let's take a look at a couple more stats here on the next slide around medication concerns. In the same survey, at least half of those that were surveyed said that they don't have conversations with their families about medication, but most agreed that it is important. And if you think about the families that you work with, are they talking with their loved ones about their medication management? And for those that are not, about half of seniors surveyed said that they don't want to talk about their medications because they don't want to burden their families with the potential issues that come along with medication. But for those that do talk about it, over half the respondents felt that communication with family members increased their confidence among everyone in the situation that's involved with making sure those seniors' medications are taken properly. And 77% agreed that the ability to remain independent depends on the ability to manage a complicated medication regime. So some people are talking about it, some aren't, but most people agree that it's really important to have an organized medication regime when it comes to staying independent, staying healthy. So on the next slide, let's look at some of the challenges that seniors are facing with medication management. The first is medication adherence, and I just wanted to define that quickly for those that weren't quite sure what that meant. And medication adherence occurs when a patient takes their medication according to the prescribed dosage, time, frequency, and direction. And a breakdown in any one of these elements has the potential to result in unanticipated side effects and complications. And poor medication adherence or non-adherence limits effectiveness in medication management and especially the control of chronic illnesses. And this poses a challenge because it increases the likelihood of preventable disease progression. It can increase hospitalizations. And if medications are managed properly, it really can avoid doctor's visits and emergency room visits that would otherwise be unnecessary. And it also can cause problems for poor health, and that could ultimately increase the costs for the seniors, not only in hospitalization costs, but also medication costs. So when it comes to medication adherence, getting timely refills can be a challenge. And according to the National Consumers League, 20 to 30% of medications, the prescriptions are never filled. And that's about 1 in 5 new prescriptions going unfilled. So if you can imagine, your senior goes to the doctor, gets his prescription, and then about 1 in 5 of them never even get it filled. So, of course, that can cause some problems in managing the medication effectively. And then even if they do get those prescriptions filled, there is a challenge in remembering to take the medications. And this obviously affects the adherence of the medications. And medication adherence drops after the first 6 months, and about half of patients don't take their medications as prescribed. So it's definitely a challenge. But maintaining independence can also be a challenge when it comes to medication management. And according to the Journal of medical internet research, older people want to maintain independence and in control of their medication treatment decisions. And this can pose a challenge when they start to need assistance in this whole process of managing their medications. And I'm sure you've heard this from some of the seniors you work with. They worry about taking too many medications. And they often complain that they're taking too many medications. They're skeptical of the rationale behind it. They're asking, what are the benefits of taking multiple medications, especially if it's multiple medications for the same condition, maybe for hypertension as an example. And most want to reduce the amount of medications because they worry that their bodies can't handle the medications. And it also poses a challenge because multiple medications can add unnecessary costs in their mind. But I think, of all these challenges, the most important one is miscommunication that happens, especially when a senior has multiple doctors. And the coordination of medications between doctors and the reconciliations of these meds can pose significant challenges. Many patients assume that their doctor uses the same computer system or can view health and medical information from their other doctors. And in some cases, that is true if their doctors are within the same medical community. However, if they're not, this kind of creates a false perception. And for a lot of people, their records might not be well maintained. There might not be an information sharing between doctors. So this can prove to be a significant challenge in making sure that there is proper medication management and that the care is well coordinated. And we'll talk more about that later. Another challenge that seniors might face are adverse effects, side effects, and drug interactions. Have you ever heard a senior say, ever since I started taking this medication, I just don't feel like myself? If that's the case, then a senior might be less likely to continue taking it. And if you hear a senior talking about that, I just don't feel right since I started this new med, they need to contact their doctor because this can trigger the cease of compliance with that medication. It might be causing negative side effects or an adverse drug reaction. So these adverse drug reactions can cause hospitalization. So if there is something kind of strange going on, some different side effects, contact the doctor immediately because it needs to be addressed or at least need to talk through it. There's a couple more challenges that I have listed here on this next slide. So the first is the fear of asking questions. I don't know about you, but sometimes when I go to the physician, he's talking so fast and rushing through the explanation about my new medication, and then he hands me a prescription and says, do you have any questions? And I'm still kind of trying to process what he even said, and I usually end up saying no. And as soon as I leave the physician's office, I come up with like 3 or 4 questions and have to call back. But some seniors have that fear of asking questions. Especially this generation of seniors now, they've grown up thinking, whatever the doctor says is what I'm going to trust. They're very trusting of their physicians. They don't ask a lot of questions. They might be fearful to ask questions. But I think that this will change with the boomer generation. They've kind of grown up with the WebMD. They're looking up things online. So they might have more questions for the physician, but the current generation might be fearful of asking those questions, so that might pose some challenges. Also, the high cost of medication can of course, cause challenges, especially for those that are on a limited income. Some people may be forced to choose between purchasing their medication or purchasing food. They might have to choose between prescription costs or their utilities. So, they might choose instead to cease the medication altogether. So that could, of course, pose a pretty significant challenge. And then not taking prescriptions in the proper way. For those that fail to read the label or can't read the label due to maybe cataracts or macular degeneration, they might not get the proper instructions. They might try to crush a pill or might try to empty a capsule and eat it with yogurt or applesauce if they have a swallowing problem. And, it might be a time-release capsule, so it might be very dangerous for the senior to take the medication in an improper way. So they might need to consult the doctor, of course, before doing any of that. But when working with seniors, we need to make sure that they understand the proper way to take the medication in order to prevent some challenges there. And then some seniors, they don't want to have to bother their family caregiver with these questions, with assistance. And I know in my experience, I found that it's usually the oldest adult sibling, usually a daughter, comes over once a week and refills that Medi-Set for mom or dad. And many of the seniors that I worked with, they felt bad that their child had to come over and do this for them every week. They don't want to have to involve their family in the medication management because they don't want to be a burden. And they might also feel like, okay, if I have to ask my family member for help in this situation, they're going to perceive it as, oh, mom or dad can't handle medication management on their own, and they might put me in an assisted living facility or send me somewhere. So that could be another reason they don't want to bother their family caregiver. And then finally, just in our experience at Home Instead, we found that when there are 4 or more medications involved, it automatically causes some challenges just in trying to manage all the different medications. So I think we still need to, Steve, if you could click for the next couple bullets. I kind of went through those a little quickly. I apologize. I'll give you all, could we go back? Sorry, I just want to give everyone online a chance to just look at those points quickly before we move along. So now that we kind of know the challenges, I also want to talk through some of the signs to look out for when medication may be to blame for health issues in seniors. So, okay, Steve, now to the next slide. Thanks for that. All right, so on to these 10 signs. Distinguishing between medication side effects or a reaction or illness is best left, of course, to healthcare professionals. And we at Home Instead have worked closely with Dr. Jane Potter. She's a geriatric physician and director of the Home Instead Center for Successful Aging at the University of Nebraska Medical Center. And she always says it's important to talk to a doctor before drawing any conclusions, but she also identified 10 signs of potential problems that could result from medication mismanagement or side effects. So I wanted to share those with you today. The first is new symptoms. If there are new symptoms that are coming about, such as dizziness or nausea, it could be the medication side effect or reaction. So it's important to always provide the doctor with a list of medications they're currently taking, including a description of who prescribed the medications. That way, if the doctor is prescribing something new, they can make sure that it's not going to interact negatively with another med that they're already taking. Also, if a senior has a change in appearance, maybe their skin tone or color is off, maybe they're more lethargic, maybe their body weight is fluctuating, this could be a cause of a new medication. So, of course, contact the doctor. If there are full pill bottles, that might mean that seniors are not taking their medication. It's a definite sign. So if you believe that they're confused about what medications to take or are forgetting to take them, this person could be at risk for problems. So, of course, it's important to make sure that whoever is helping them coordinate their medication, that they are facilitating that. And if that individual has not been taking the pills, contact the doctor and see what the next step should be. Mobility issues might be another sign. So if a person is experiencing dizziness or lightheadedness, it might also affect their mobility, the change in gait, their energy levels to get up and walk about. And this could be the side effect of a different type of medications, especially we see more commonly in blood pressure treatment. And those side effects can, of course, impact the mobility of seniors, and especially those that might already be suffering from arthritis or other issues. So it's important, if there are some mobility issues, to make sure that the home is safe for them to get around and, of course, contact the physician. Changes in thinking, reasoning, or mental activity could also be a sign. So there are many potential causes for forgetfulness and other confusion, and one might be because of a medication problem, and it could be because of over-medication. So it's important to fully assess the cognitive and mental changes, because medication could be to blame, and an important reason to contact a physician. And the next 5 signs are on the next slide here. Difficulty performing activities of daily living. Any potential side effect of medication could make managing self-care a challenge. So if a person, who typically is able to bathe and toilet, eat on their own, dress themselves, if there are changes in this activity of daily living kind of routine, there could be some potential side effects of medication. They're having some serious consequences in terms of their ability to take care of themselves and affecting their independence. So that's a definite sign that something might be going on. And also, if somebody's having trouble sleeping, especially with drugs such as antidepressants, it can potentially lead to insomnia and the need for sleep medication. So the senior might have to talk to the doctor about ways to help avoid these side effects, or maybe prescribing a sleep aid if appropriate. Changes in appetite can also be an indicator. Some medications might increase or decrease appetite. I know steroid medications can increase hunger. So if an older adult is having problems with appetite, ask about scheduling a meeting with a nutritionist. That might be helpful for that individual. Difficult maintaining a home. Let's face it, when an older adult is not feeling well because of these side effects of medication, keeping a home clean, preparing meals, paying bills, kind of the day-to-day stuff might become impossible for them. So if you see a senior's home kind of start to fall apart, or notice that things are kind of in disarray, it could have something to do with maybe a new medication that they just started, some side effects that are resulting from that. And then finally, if you see a change in their overall well-being, it might be because medications aren't being taken correctly. And if that's the case, it can, of course, affect the entire well-being of seniors. So be sure to have the senior's medications reviewed in this situation, and it's kind of just a best practice to have them reviewed annually or anytime that there is a prescription change. So these signs indicate that there might be some health issues, but there are certain chronic conditions that more specifically impact medication management, and so I wanted to go through those quickly here on the next slide. So the first of these is arthritis. Arthritis is very common. About 1 in 5 older adults are diagnosed according to the Center for Disease Control, and some forms might cause some widespread symptoms. And taking multiple medications for arthritis could have some potential side effects. So when working with someone with arthritis, be on the lookout for the use of anti-inflammatory drugs, and these could lead to stomach problems, heart problems, and kidney damage. And some solutions for this, of course, consulting a doctor, but there might be other ways to help kind of ease the pain that they might be feeling. Things such as water, exercise, physical therapy, heat and cold packs, those types of things. Another chronic condition that could impact medication management is COPD, or chronic obstructive pulmonary disease. And this is a lung disease that, of course, obstructs the airflow to the lungs and can lead to shortness of breath and coughing. And although it's effectively treated with a variety of medications, these medications could carry some side effects. For some, it could be weight gain. They could also be diagnosed with diabetes, osteoporosis, cataracts, and these could also cause some infections such as fever or redness. So those are some signs to look out for. They might also be experiencing a fast heartbeat or shakiness as a side effect of some of the medications they're taking for COPD. So, of course, this individual should remain under close doctor observation, and if there's any changes in the medications, this might have an effect on their diet or the symptoms that they are experiencing. So it's always important to keep in close contact with a physician if the individual has this disease or chronic condition. The next is diabetes. And to treat diabetes, insulin and oral drugs are among the top 4 medications, and they can be used alone or together. And there are some risks with these medications, and for some, if not taken properly or used properly, it could end up in a hospitalization or emergency room visit. So some side effects of using diabetes medications can run the gamut from nausea and diarrhea to cold and flu symptoms, and Also, there could be some potential reactions to insulin or pills that are used to lower blood sugar, and it can cause some confusion or even unconsciousness in these individuals. So some solutions for this, new studies show that older adults with adult onset or type 2 diabetes need a higher target blood glucose level than was previously recommended. So keeping regularly scheduled doctor's appointments if a person has diabetes is really important, especially to get the newest, latest, and greatest information. And reducing over-treatment and the incidence of low blood sugars can help to minimize the risk of hospitalization in those with diabetes. Next is heart disease and stroke, and about every 43 seconds, someone in the United States has a heart attack, and that's according to the American Heart Association. So it's a very frequent condition, and I've seen this in a lot of older adults that I work with. And treatments for this can vary and could have some risks, of course, or side effects in the medications that are used. And someone with heart medication should check with the doctor every time a new medication is added, removed, or changed to help protect against any adverse medication interactions. And managing heart condition might require even a lifestyle change from weight loss or stress management, even proper nutrition and physical activity. So those are ways that can kind of help to manage that specific chronic condition. And then stroke. It's a disease that affects the arteries leading to and within the brain, and it's the 5th leading cause of death and a leading cause of disability in the United States, according to the American Stroke Association. So if you have suffered from a stroke, the potential risks of not following a medication regime could be hazardous. And if someone is missing their medication, this could cause blood pressure to go up and further increase the risk of having additional strokes. So medication for strokes, of course, can also pose some side effects and risks, especially for those on warfarin, which is effective in preventing strokes, but it also may interact with other medications and as a result might increase the risk for hospitalization. So some preventative measures could include lifestyle changes, blood pressure control, exercising. If a person could stop smoking, that would help with it. And these are good ways to help kind of maintain the health of someone with a stroke or prevent it. So in addition to these chronic conditions that impact medication management, there's also some mental and memory conditions that can impact as well. So we'll take a look at those here on the next slide. The first is Alzheimer's disease or other dementias. And while there's no cure for Alzheimer's disease, there are medications that can slow the increase of symptoms, such as memory loss, confusion, and problems with thinking and reasoning. And an individual with dementia might be unable to manage a complex medication regime. Someone in the early stages, they might be okay to manage the medications on their own, but as the disease progresses, it can become more difficult, and family members will have to stay involved and develop a plan for assistance when the senior can no longer manage themselves. So be on the lookout for potential symptoms of the dementia illness, such as confusion, memory loss. The medication management might also be a sign that they are starting to develop the disease. They might also experience mood changes and problems with judgment. So there are definitely some safety tips that families can implement to help in the medication management process. Depression is also something that can affect medication management. And for some folks, depression is severe enough to impact their ability to function, and especially with medication management. And while medications can be helpful and life-saving, they also might increase risks of falls, fractures, and bone loss in older adults. So be on the lookout for side effects of drugs that are used to treat depression, such as antidepressants. And these side effects could be nausea, increased appetite, weight gain, insomnia, and constipation. It's important to consult with a doctor about whether or not an antidepressant is the correct solution. And if they decide to stop taking one, make sure to consult the doctor And if they're experiencing those symptoms, of course, consult the doctor as well. And then the final condition is anxiety disorder. And until a few years ago, anxiety disorders were believed to decline with age. And that's because older patients were less likely to report psychiatric problems and were more likely to emphasize their physical complaints. But experts now realize that aging and anxiety are not mutually exclusive, and anxiety is common among older adults, almost just as much as among young people, and that's according to Anxiety and Depression Association of America. So doctors often prescribe lower doses of anxiety medications for older adults, and it's important to ensure that medication is given at the right dose and not, again, adversely reacting with the other medications that the senior is taking. And some potential side effects and problems of these medications could include upset stomach, insomnia, constipation, and blurry vision. So family members may need to make sure that their senior loved one's medication side effects and other issues encountered during treatment are reported to the healthcare physician or provider promptly. So now that we've gone over all this, I'm going to pass it over to Kyle, and he is going to talk about how to avoid medication mistakes here on the next slide.
Thank you, Lakelyn. It's a pleasure to speak with all of you today. Like Lakelyn said, let's talk a little bit about avoiding medication mistakes. But first, I'm going to give you kind of a little case study. Consider a 92-year-old male living in an independent care community and has usually been skilled at managing all of his medications. But after an exacerbation with CHF, the doctor prescribed a diuretic to help relieve some fluid from the system. It worked and he got better. So what did the male do? He quit taking the medication. One thing led to the next, and the patient was right back in the hospital. And I say this because I've seen it in everyday pharmacy. It's a normal misconception of seniors that when they feel better, they can stop taking their prescriptions. And I think a lot of this goes back to just the education of acute medications versus chronic medications and knowing why you're taking the medications and how long you're supposed to be taking them. So what can we do to avoid mistakes? Well, following Dr. Jane Potter's suggestions, the number one thing is to get a pill organization system or device. About 50% of patients don't take their medications as prescribed according to the World Health Organization, which is a staggering statistic. It's obvious why this is a major problem in our society. I suggest that you go to simplemedsrx.com. It's a all-service pharmacy. The pharmacists package the medications, including prescriptions, OTCs, and vitamins, in multi-dose packaging, and it's according to the day, date, and time they should be taken. So that's one way to do it, but there are all sorts of different packaging or pill organization MediSets systems out there. Another thing that we need to do is make sure that there's one doctor that's the gatekeeper of all medications. So by saying this, we mean that as a senior ages and has more diagnosed chronic conditions, they oftentimes see multiple physicians. They'll have a primary care physician, they'll have an endocrinologist, or they'll have a cardiologist. And when you add on more physicians, it gets more confusing not only for the patient, but also for the providers. So an example of why this is so important is if a patient is admitted to the hospital and then discharged, typically when they go home from the hospital, they're provided a 2-week or a 4-week supply of temporary medications, and then it's on them to see their primary care physician for follow-up. So it's really important that primary care physician or point physician, if you will, it knows exactly what the patient's taking. Another thing to do is know why your senior's taking the medication. What specific conditions or symptoms are the medications being prescribed to alleviate? Make sure that your loved ones can read and understand the medication instructions. That's a big barrier, is not knowing why or understanding how to take the meds. Another thing that Lakelyn hit on earlier is contacting your doctor if you notice that the senior is thinking, feeling, or looking differently. Oftentimes, as the caregiver, we know more, or we feel like we know that individual better than anyone else. So if you see something, say something. The next thing is to keep regularly scheduled appointments and an open dialogue with your provider. This is a barrier to adherence simply because if you don't keep the regularly scheduled appointments and they're due to be seen, a lot of times the prescriber won't refill prescriptions when in a timely manner. So make sure that you do that and encourage your senior to always make sure that they go to their doctor when they're supposed to. And one point when you go to see the doctor is make sure you write down questions beforehand. A lot of times, like Lakelyn alluded to earlier, you get in there and you're listening to what they're saying, but it's difficult to comprehend everything. But the same is with making sure you get your questions answered. A lot of times you go in thinking, I want to ask the doctor these 5 things, and then you can't remember once you get in there exactly what you want to ask. So the next slide then talks about a few more items that we can do to avoid medication mistakes. The first one is if your senior's having trouble paying for all the medications, talk to the doctor or pharmacist. One of the biggest barriers to adherence is medication cost. And if a senior is having trouble paying for medications, a lot of times there's a generic option that's an alternative for that specific therapy that can be prescribed instead of a brand. Sometimes pharmaceutical companies for brand name products will offer discounts and discount programs. But also one that we forget about oftentimes is talking to the local doctor or pharmacist about city or area discount programs. For example, a patient has Coventry Part D prescription insurance. However, when they hit the donut hole, they stop getting their prescriptions because they can't afford the copays. So a lot of times there'll be local level prescription assistant programs if the patient qualifies to help with those copays. The next thing is to tell your healthcare provider if your senior is depressed. And Lakelyn hit on this a little bit, but medications can actually contribute to depression. But the one thing we do know is that depression really makes it more difficult to take medications as prescribed. So that's a big point there. Discuss any problems a senior is having taking medication. We see this all the time in pharmacy. Dexterity problems and trouble opening pill vials. The child safety cap is too difficult to get off, so they just don't take that medication. And that's a simple solve. All you have to do is talk to the pharmacist there at the counter and tell them that you want easy open caps, and it's usually as easy as putting in a waiver in the computer system and flipping the cap upside down, and it becomes an easy off vial. Another thing is if they have trouble swallowing, there's sprinkle formulations, and not the kind that you put on ice cream, but rather capsule sprinkles, and you can open the capsule and put it in applesauce or yogurt, or if they have trouble swallowing, sometimes a liquid is better prescribed. Tell your provider if your loved one's forgetting to take medication. Oftentimes this is, just the crux of the problem. I just forgot to take it. So it's a good thing to assess what level of assistance your senior needs with your provider to take medications. And last but not least, consider a caregiver. Make sure you assess the risk of a medication mismanagement problem with your loved one. A really good place to go is Let's Talk About RX Solutions Guide, and it's at the website letstalkaboutrx.com. If you're feeling overwhelmed or unable to manage medications, or your family caregiver is worried about an older adult, make sure you consider a caregiver companion, and you can check out your local Home Instead Senior Care or homeinstead.com. There's a lot of good information there as well. So on the next slide, we've talked about avoiding medication mistakes. Now let's talk about how you can improve medication adherence. And luckily, there's a really good mnemonic. It's simple. So simplify the regimen. This is probably the most important piece of improving adherence. Difficult, complex drug regimens increase the risk of medication mismanagement. So doing things that are simple, like adjusting the timing, frequency, amount, or dosage of medications is a good way to simplify the regimen. We always say in pharmacy that medication is best taken once a day, but we also know that a once-a-day medication sometimes is more expensive, so we don't want that to be a barrier. We want it to be a solution. Match the medication regimen to the patient's daily living style. So if they take a medication 3 times a day, make sure it's dosed at breakfast, lunch, and dinner, if it's possible to do that. Avoid taking medication with special requirements, such as refrigerate this medication, or certain dosing times like 30 minutes before a meal. And then also investigate, like we talked about earlier, a packaging solution for patients. It really helps simplify and manage the patient's drug regimen. I is impart knowledge. Adherence is enhanced when we understand the patient's understanding of their own conditions and benefits of the treatment. So going back to Fred would have really benefited. I'm sorry, not Fred, but Male. I called him Fred when I was practicing. The case study that I talked about earlier would have really benefited from having the knowledge and been empowered of what he was taking that medication for and knowing that it was a long-term med. Provide clear instructions, limit instructions to 3 or 4 major parts, and make sure that you don't talk in technical terms or medical terminology. And then reinforce all discussions often. So even the most simple conversations of, are you having any adverse effects or anything new happening that I need to be aware of? That's really important to make sure you have those simple conversations all the time, especially with low literacy patients. M stands for Modify Patient Beliefs in Human Behavior. We have to understand what the perceived susceptibility, benefit, and barriers are for patients that have a complex drug regimen. Ensure that they understand that they're at risk when they don't take their medications, and ask them to describe what the consequences will be if they don't take their meds. One of the biggest things that we can do, though, is just provide reinforcement and positive reinforcement. Reward them, praise them for taking their medications like they should. P is provide communication and trust. At least 50% of people leave the doctor's office not knowing what they've been told. So modifying the patient's belief and gaining their trust through communication is very important. How can we improve communication skills? One of the biggest things is actually on us. It's writing down the questions before we go and see the doctor and make sure everything is addressed. Provide clear, direct, and thorough information. And make sure that we allow adequate time for the patients to ask questions. Don't be in a hurry. That just aids to the antitrust type of feeling. We want them to know that we care about them. And then lastly, ask the patients to teach you back after you give them the instructions and allow them to write down the instructions. It'll help them remember it, but it'll also serve as a resource for them to go back and refer to. L is leave the bias. We know that there's a tremendous amount of evidence out there that ethnic, minority, and socioeconomic disparities related to health outcomes across all disease states and types of care, including preventative care, exist. So we need to really pay attention to these specific patient populations and make sure that they get the patient-centered communication from the physicians and from ourselves. Lastly, E is evaluating adherence. There's a problem among all of our primary care providers out there that non-adherence isn't a big issue. And I think this is transitioning. I think this is becoming a thing of the past because with the Affordable Care Act, we know that providers in the future and currently are being reimbursed by the insurance companies based off of performance. So how adherent are their patients to their medications? How many hospitalizations and readmissions have their patients encountered? So this is gaining traction. It's kind of the pick up the rock and see what's underneath it. So every encounter we need to be asking patients very simply and very directly if they're following their drug regimen. Are you having trouble taking your medications? And ask about adherence at every single encounter that you have with them. So that's pretty much the how medication adherence works. But make sure that if you remember anything about medication adherence, the complexity of the regimen affects adherence. So always simplify when and where it's possible. And with that, I'll turn it back over to Lakelyn.
All right. Thanks, Kyle. Those are some great tips. And on this next slide, we're going to just touch briefly on communication. And Kyle has already kind of went into how important communication is. And I think in most situations when a senior is involved with a complicated medication management system, the communication around it is key. So it's important to remain helpful and positive and also to remain calm. And remember, it's not about control. Try to maintain the senior's independence as much as possible and remain on their agenda. Also try to empathize with them and put yourself in their shoes. It can really kind of change your perspective on the situation. And don't forget to listen. A lot of times we don't want to listen. We just want to do. But listening can pave the way to success. And also our body language can have a big impact on the situation. If you're talking to the senior and you're relaxed and calm, it'll show on your face and in your posture and in your tone of voice, and can really put some ease and calmness into the situation. And when visiting the doctor, be sure to take some time to really visit and understand, and Kyle talked about that earlier. And then it's also important to make sure that the senior feels a part of the solution and that they're not losing control. Again, making sure that they're feeling independent as much as possible. So now let's end here on the next slide with some resources. We've already touched on the letstalkaboutrx.com, and this has some great conversation starters for families, in addition to some resources that we've kind of touched throughout this presentation. So it's a great resource. And then safemedication.com is a site where you can do a quick medication search. Also, again, great tips and tools, and can answer some frequently asked questions. And then, as Kyle mentioned earlier, simplemedsrx.com has a great solution for seniors in simplifying their medication regime. And as Kyle mentioned, simplifying the regime is probably the most important thing we can do to make sure that the adherence is followed when it comes to medications. Also, On Time RX can help you set up a timely email, phone call, or text message reminder for taking medications, so that can help a loved one or a patient that you're working with. And we've talked a lot about how important it is to have a medication list and doctor's information, especially when it comes to an emergency situation. So the senioremergencykit.com can help you organize that information. You can print off a senior emergency kit, and that way you can keep all the information handy, maybe on the fridge, or each member of the care team can have a copy of that. So now that we have some resources, I'm going to open it up for questions. Sorry, we kind of ran over. We only have about 10 minutes for questions, but we're happy to answer those now.
All right. Thank you very much, Lakelyn and Kyle, for a great presentation. We also want to welcome here Lanita Kanoki to the line for the questions and answers. So welcome, Lanita. Okay, everyone, it is time for the questions and answer period. Anything that is on your mind, just send in those questions to our presenters here, the things that we've been talking about. The first question here, as an in-home caregiver and not a member of a family, how should I approach a situation whereby I feel that there's not some medication adherence going on? The family seems to be a little bit oblivious to this, but I'm beginning to be concerned about this. How do I broach this topic?
That is a great question. If you are an in-home caregiver and you work for an agency, my suggestion would be to contact the agency and let them know that the medication compliance is not happening, and then it can be that care coordinator at the agency that can then approach the family about this topic or situation. If you're not working for an agency, if you're an independent caregiver, maybe a private caregiver, friend, family, neighbor, I think it's important to address this issue with the family, even if they are a little bit oblivious or to the situation. They might not be in the home as frequently as you are as the care provider, so they just might not have the eyes and ears on the situation. So if the care provider has that knowledge, and especially if you can track, if you have any sort of tracking system to track when the senior is taking the medication, then that can provide you with further kind of evidence of sorts that you can bring to the family and show them. Or if we talked about, one of the challenges is or risks or signs are pill boxes that are still full or pill vials that are still full. That could be an indicator that they're not taking their medication. So you could bring those to the family and say, look, it was prescribed on such and such day and it's still full. Clearly this loved one's not taking the medication. Let's look at some options on how we can streamline and simplify this for the individual that's being cared for.
All right. Kyle, this next question is for you. Are there benefits to having medications compounded for medication adherence?
I think that's a really good question, and it really depends on the disease state. Some more complex disease states, if it's, for example, immunological, the compounded pharmaceuticals are the way to go a lot of times, but not in all cases. So we know that most of the other chronic conditions, such as diabetes, is best alleviated by insulin and oral chronic solids. So I think it's a disease state specific question, but there is definitely a right place and time for those compounded products.
Okay, next question. Is there a reason that many medications come with instructions to cut or split them rather than dosing them correctly for seniors?
I think that a lot of times what we see the split or cut pills are intended for is to actually save the person money, where their copays are prorated based off of how many pills that they're actually prescribed. So for a 30-day supply, they're getting 15 tablets instead of 30. But we have to be careful with that one because sometimes pills are formulated for an extended release or for a longer duration of time. And if you cut those pills, then all of that medication could be released all at once, and there could be some disastrous effects from that. So the cutting and splitting the pills, you always want to consult with a pharmacist or doctor first and make sure it's done for the intended reason.
Okay, next question. Is there a list of medications that are not recommended for seniors? You're especially interested in mood and behavior medications.
There is a list of medications out there. If you Google Beers criteria, B-E-R-S, there is a list of medications that are either better prescribed at a lower dose or not prescribed at all for seniors. And many of those are associated with fall risk or low blood pressure, or simply the patient doesn't clear the medication quickly enough, so it needs to be a dose adjusted. I would suggest looking at those Beers criteria, and there's a good list of meds out there on all different types of disease states.
Okay, next question. Can pain medication be interchanged, especially since there is a limit on the number prescribed?
That's a really good question. So pain medication can be interchanged, but it has to be done with the dosage help of a doctor or a pharmacist. So there are formulas that have to be applied when you're switching pain medication, and we also need to watch for cross-interaction. So if the patient's allergic to an opioid, then they shouldn't be taking a certain list of meds. So I guess to answer the question best, pain medication specifically can be interchanged, but it's not a dose equal to another dose interchange. There's a formula that goes into it, and I strongly recommend consulting your physician on that one.
All right. Lenina, this next question is for you. How would you talk to a senior who is taking an excessive amount of over-the-counter pain medications, for example, going over the stated dosage amount by at least double a day, but they don't see it as a concern even when you go over the risks and directions?
That's a great question. I think you would have to go back to what the condition is and the relationship that you have. So it would depend on who's having that conversation with that senior. Sometimes having that conversation needs to come from someone other than a caregiver, or especially a family caregiver, because they just tend to listen a little bit better to a clinician. And then I think it all depends. It's more of an individual question. You would have to have more details around, what they were on and what the situation was.
Okay, next question. I used to make a list of the tenant's medication and leave it posted in their apartment. It was then told to me not to do so because the medication could change unknowingly and cause more harm than help. Is it safer to not list particular medications and just list the condition that the person suffers from? The ER will do an evaluation or assessment and go from there. So how would you deal with a situation like that?
Is this referring to a situation when the individual is going to the emergency room, I would assume?
Yes, I'm reading it as kind of a assisted living or situation like that, where they list, in this person's living space what particular medications they're on. And as this question refers to, that could change, and then, what do you do from there?
That's a great question. most assisted living facilities, at least in the state that I live in, are required to keep a current medication list. And having it posted in the room, I could see where that could cause some confusion, especially if the list is always changing. So in an emergency situation, I think it would be best to contact, the director of nursing to get the most updated current list of the medication if it's needed. But if you are, a caretaker and you're giving the medication to the senior, you're right, it could change. So anytime a senior goes to a physician or has a change in medication, if that list can be updated, it's very important. But I think it could be beneficial to have both, the conditions that they suffer from in addition to the medication list in, like a senior emergency type kit that maybe is kept on the fridge in case of emergency or in case it needs to be referred to. And that way, as the medication regime is changing, that hopefully that list will also be updated. But if it is a true assisted living situation, the director of nursing, correct me if I'm wrong, Lanita, but the director of nursing should usually have that updated medication list at all times.
Yes, the director of nursing would always have that list. And as long as they're in assisted living, I would definitely refer back to her.
All right, next question. Would it be possible for pharmacies to dispense medication in bubble packaging?
That is definitely a possibility. It depends on the pharmacy. Some pharmacies offer that type of service. Some offer it at a charge, some at no charge. I would suggest just inquiring with the local pharmacy and seeing what type of services they offer. There are a lot of different services out there, but bubble packaging is a way to increase adherence in seniors.
All right, now this question is kind of for the panel. Speaking of adherence, how common is lack of adherence to medication management? In other words, what rough percentage do you see in your professional lives where this is happening, and what can we do to get the word out about this?
I think there's actually two answers to that question because most seniors are not, their noncompliance is really more about understanding of their medications than about anything else. Or it's either the understanding or they don't have the funds. So I think that there's just a couple of different ways to look at it. Kyle, did you have more to add to that?
Yeah, I think it happens at a much higher rate than we realize. I can tell you that the pharma companies that are actually out there developing drugs develop their dosages based off of 85% compliance. So if they're believing that 15% is non-compliant, taking their medication 100% of the time, they're banking on the typical customer only taking 85% of the time. So that gives you some feel as to how often it happens, but I think it's much more common than we think it is.
Right. Well, we have reached the end of our hour here, and we are just about, unfortunately, out of time here today. But I want to thank our presenters for a great presentation. Lakelyn Hogan, Kyle Decker, and Lanita Kanoki, thank you very much for being here and presenting with us today. Thank you.
Thank you for having us.